Welcome to ROI's Couch Conversations. Today we're excited to introduce ROI's Executive Director of RevCycle Services, Jeff Tennant. Jeff, can you share with us more about some of the biggest information capture challenges that healthcare systems face today?
Information capture in the registration process is a very key element to the entire stay for a patient in an inpatient environment. The better job an organization does of capturing appropriate and complete and accurate information, the better the entire stay is going to be from an information perspective. It impacts everything from the area of a physician having all of the information they need in the system as they're beginning treatment on their patients, everything from problem lists to admitting diagnosis, working with the registration, scheduling staff to ensure that all of the demographic information is correct, working with the registration staff to ensure that insurance is both verified and validated, so you make sure not that the patient has the insurance that they say they have, although that's very important. Also validating that the procedure that they're in for is covered with the insurance policy that they have in place. Checking things like medical necessity, and then in the instance of Medicare, obviously approaching the need for an ABN. Proper ABN processing isn't so much about pushing the burden to the patient, but ensuring that what the patient is there for is indeed medically necessary. There's processes that can be put in place to work back with the admitting physician to ensure that the request for the procedure or for the tests that are being requested is complete, and making sure that medical necessity is being met and that those procedures will be covered by that patient's payer of choice. So these are all areas that we see as being important from an information capture perspective.
So for those involved in the process, what types of training opportunities exist?
I've seen over the years, a lot of issues in this space. Typically, you're admitting registration folks in a hospital are younger, not as skilled in medical terminology. There tends to be more turnover in this space maybe than any other area of the hospital. And so you're typically working with folks who have learned on the job the bulk of what they're doing. I think enhancing the ability of those folks through training, having standard onboarding and training sessions for them to understand how to better utilize the technology available to them, making sure they have technology available to them to complete the tasks that are required to do a better job of capturing and verifying the information. Things as simple as address verification and validation, skip tracing, things like that. Also having the online availability to verify insurance eligibility and again, the medical necessity component. So training them, making sure they have those technologies available is very important. The benefits of all this, and some people say, well, we can always get this on the back end. Collecting correct insurance information and correcting bad demographic information on the back end is significantly more difficult in that you do not have the patient in front of you. You cannot, ask the follow-up questions as readily. You do not, have the same type of systems available to you. And it also slows down the ability to collect money for the organization. Sometimes if the wrong insurance has been entered into the system and the claim has been billed to the wrong insurance and then denied and back and forth, you could actually miss timely filing with an insurance company because you simply had the wrong information in the system to begin with. Things just as simple as birth dates and addresses and those types of social security numbers. Those types of things are very, very important to get up front. So again, making sure that your staff is trained in the use of the systems available to them and gets that information correct is extremely important. And the benefits of this are not only financial from a billing perspective, but also, patient safety and physician satisfaction can be tied to this information as well. If a physician has all the information they need as that patient's being admitted into the hospital, their problem list will be updated and accurate. A lot of other little things will be what they need to be in place. allows them to be more effective in navigating the system as well. From a patient safety perspective, obviously making sure you have the right patient, right medical record number is very important from a patient safety perspective. Things as simple as things as blood transfusion, given the wrong blood type to the wrong patient, obviously can be very catastrophic. I know there's a lot of other safeguards in place, but making sure you have the right patient, right medical record number as you're admitting that patient helps streamline that process.
What other benefits can you share related to proper information capture?
An additional benefit to proper information capture is as we look at the future of healthcare, population health management, and things like that, knowing more, being able to capture more information about your patient population as they're being admitted to your organization is going to be important. Additional demographic information to help determine social determinants of health as well are going to be key. And having correct information up front will then allow your organization to do a better job of mining that data and providing useful information to your physician and your hospital leadership to do a better job of managing your patient population.
Jeff, thanks so much for sharing your knowledge with us today. And to our audience, make sure to check back for our next episode on revenue cycle charge capture.